Dr. Ciri.
And I'm Dr. Eva. Welcome to Sisters in Medicine.
Today we are going to be talking to you all about antibiotics.
Let me ask you a question, Dr. Ciri. What's your overall opinion on antibiotics?
I think they're great. I think they are one of the medicines that we have that can actually cure people of the diseases that they have. So I think they're great.
Tell everybody what an antibiotic treats and what are the different kinds of other bugs out there that are not bacterial that antibiotics don't treat so that they know the difference.
Antibiotics is like a broad category that refers to medicines that fall into antibacterial category, meaning they are antibacteria, so they fight bacteria. Then there are antibiotics that fall into the antifungal category, meaning they fight funguses. And then there are antibiotics that fall into the antiviral category, meaning they fight viruses. So depending on the type of infection that a person has, like let's say someone has gonorrhea or chlamydia or a bacterial pneumonia, then they would need an antibacterial medicine. If someone had like a yeast infection or even a fungal pneumonia, they would need an antifungal. If someone has a herpes flare or HIV or even the influenza virus, they would need an antiviral. Now, the other types of viruses, like the cold virus, things like that, that don't have specific antivirals to treat them, those are things that don't require any prescription medications. You just let them run their course, you drink fluids, you go see your doctor to be sure you don't need any prescription. But if your doctor tells you you don't need a prescription, then you don't need a prescription. You just let the symptoms run their course and let that be that.
In conclusion, from what Dr. Ciri is saying, antibiotics only treat bacteria. It does not treat viruses and it does not treat funguses because those two other categories are bugs that can also cause diseases and symptoms and issues. But today we're going to focus on antibiotics.
Let's say a patient goes into your husband's urgent care facility because they're having a fever and a cough or something like that and a sore throat, and they're asking him for antibiotics, and they may not need them. What do you think we should educate the people about from that standpoint?
I just think that most people, when they start feeling sick, whatever the symptoms may be, if they have a runny nose, sneezing, even a fever, when they go to the doctor, they are already expecting to leave the doctor's office with something, either a prescription or something. They don't want to go to the doctor and come out empty handed because they feel as though they wasted their time or the doctor did nothing for them. What I want them to understand is that most doctors, if they are like me, will talk to the patient, take a thorough history, do an examination, even order blood work sometime before making their decision as to whether or not the patient needs to be treated. A lot of times, even if you have a fever and other symptoms, it could be viral. I'm somebody who doesn't like to throw antibiotics at every patient that I see just because they are expecting me to give them something. I feel like if they don't need an antibiotic, I will probably give them a couple of days to see if their symptoms will resolve or improve. And if it doesn't, I'll have you come back and decide at that time if you need to have an antibiotic or not. Only because bacterial infection, bacteria are very, very smart. And what they do, and they work overtime to try and be smarter than the medications that we have created to kill them. And so if I give you an antibiotic and you don't necessarily need the antibiotic, I'm doing you a disservice. I'm actually causing possibly some resistance to developing, and even out in the community. So a lot of doctors don't like to give antibiotics unless it's necessary.
Since you mentioned that antibiotics kill bacteria, I think one thing we should address is the idea that people think that antibiotics hurt them, like are fighting their bodies, when really the antibiotics are designed to fight the bugs that they're supposed to target.
Right, there are extremes instances where you're gonna have people that always want an antibiotic for everything. And then you're gonna have the other extreme, people that don't want them no matter what. I think we need to find a happy medium in the middle. I disagree with having antibiotics for everything because not everything requires an antibiotic. Plus, it's a problem if you're always ingesting antibiotics. But for those patients that don't want it at all, I just think that they need to be open to having to need an antibiotic sometimes. There are conditions where you have to have antibiotics, such as meningitis, for example. If you have a bacterial meningitis, even if you're a natural person who likes to take herbal medication, natural medications, sometimes you need an antibiotic because you can die from having meningitis. Also, pneumonia. There are some bacterial pneumonias that can make you very, very sick, and you can die from that too. And so you need an antibiotic for that. I have a question for you though. Can you tell me what you think about herbal medications and herbal medicines in general, just the natural type of medications out there that people think are the way to treat everything?
Disclaimer, I'm not an herbalist. What I do know about them is that there are side effects to herbal medications. I do know that they aren't regulated by the FDA, meaning there's no standard dosing or way of packaging them to ensure that what you get from GNC is the same thing you're going to be getting from wherever else. You should know that they're not without side effects, just like any medication, whether it's a holistic medication or a prescription medication. Side effects are associated with both. The thing about prescription medications is that we kind of are more familiar with the side effects because we've studied the medicines, we have standard doses for them. With the herbal medications, it's a free for all. You never know what you're going to get. That's what I know about herbal medications.
Right, and I just want to put it out there as well. When you go to your doctor and your doctor determines that for whatever reason an antibiotic is what you need to treat your infection, whatever that infection may be, I just want to make sure that the patients take their medications religiously the way it was prescribed, the amount that you're supposed to take, and how often you're supposed to take that medication. Because if you start feeling great 2 to 3 days after you start taking your medication, and you decide, well, I feel good now, I'm going to stop taking my antibiotic and save it for my next symptom or my next sickness, that may be an issue because the bacterial infection that we're treating in you that's almost killed and almost dead, what you're doing by not taking your antibiotic is allowing that bacterial infection to reignite and grow back. And that bacteria can grow back with a vengeance and become resistant to the medication that you were prescribed originally because you didn't entirely kill it off. Don't share your medications with your mama, your auntie, your best friend, your cousin. You shouldn't have any medication left to even share.
I 100% agree with that.
If you guys have any questions whatsoever, or there's something you want to hear about that we haven't talked about, reach out to us, let us know, and we'll be happy to answer those questions.
That's all for today. Let us know if you have any questions. Don't forget to like, subscribe, and comment below. Let us know what topics you all want to hear about next, and we will be happy to deliver. Until next time.
Bye. Okay, we're going to have to stop right here.
Okay.
Open the door.